Louisiana Shots for Tots Coalition is a statewide coalition for the state of Louisiana. We embrace the infant immunization initiative, which is Shots for Tots. We encourage providers and parents to be aware of immunizations, the importance of immunizations, and the relevance of immunizations in this day and age. We're celebrating the 20th anniversary conference for Shots for Tots. This is our 20th year of putting on this conference. It's a wonderful conference. It's for private and public sector, and we offer lots of great speakers, information for immunizations, for providers, the immunization registry links, Louisiana Immunization Network for kids statewide. So there's lots of great information for providers about immunizations and Shots for Tots initiative.
Our current levels are about 75% for the different parameters of 4 DTPs, 3 polios, Hib, rubella, measles, mumps, and chickenpox vaccine. And we rank about in the top 20 in the USA. So we're doing not as good as we would like to, but doing fairly well.
Vaccines are one of the most successful public health interventions of all time. And in the last couple of years or last decade, people are challenging the necessity of and safety of vaccines. So today we're going to talk about how important vaccines are, but also some of the science behind vaccine safety, how we know vaccines are safe, and then how everyone can communicate to families about that message.
When you talk to parents of children about vaccines, what do you tell them?
That they're safe, and that you read a lot of misinformation in the newspapers, on the internet, on TV, but when you take a step back and actually look at the data, they really are safe.
There are 11 vaccines for the prevention of 14 vaccine-preventable diseases for children prior to the age of 2. And they're all important. Some of the diseases that we have been focusing on recently, pertussis for one, otherwise known as whooping cough. We've seen a resurgence of pertussis cases. We're now learning that immunity from disease and from past vaccination wanes more quickly than we thought. And so there's a renewed effort to make sure that adolescents receive the pertussis vaccine as well as adults. So that's a biggie. Measles, a disease that we had eliminated from the United States, declared eliminated in 2000. We are now seeing cases of measles again occurring in clustered outbreaks, but we are seeing measles come back a bit, so it's important to keep vaccinating with the measles, mumps, rubella vaccine. Those are the two big ones that we're focused on right now. Another one I should mention is HPV vaccine, human papillomavirus vaccine. This is the virus that causes cervical cancer. We do recommend this vaccine for adolescents beginning at age 11 and up through for some adults up to 26 years of age. We recommend this vaccine for females and males.
You mentioned measles and pertussis, also known as whooping cough. Just how serious are those diseases, and what kind of medical complications can they have if someone were to get them?
Well, talking about pertussis and measles, both of these two vaccine-preventable diseases are probably the most contagious of the vaccine-preventable diseases. So they will spread quickly if introduced into an area where a few people have immunity already. Measles is very, very serious disease, can lead to complications such as pneumonia, both bacterial and viral, is a number one cause of death in infants worldwide. We don't see that in the United States, but we used to before we used the measles vaccine. Pertussis, we are seeing now tens of thousands of cases every year in the United States, and those are levels that we really haven't seen since the 1930s and 1940s. So that disease is coming back. We've seen this rise actually in the last few decades, but we haven't seen levels that high in several decades. So very, very contagious disease, tens of thousands of cases of pertussis or whooping cough. That disease causes a long, protracted cough, but can be fatal in infants who don't have the benefit of the infant vaccine. So it's very, very important that we prevent transmission of pertussis.
My message is primarily about the fact that vaccinations and immunizations are both incredibly important and also safe. They're the best public health tool we have in terms of cost effectiveness. And I'm trying to make sure that healthcare providers have tools to communicate with parents about their anxieties and some of their fears regarding vaccines.
You've written a book called The Panic Virus. Tell us about it.
Well, it was a book that I started just because I noticed this was a conversation that had come up a lot with my friends when they were having children. I spent several years looking into the concerns and some of the myths, especially regarding autism. And it was definitely an eye-opening experience. And so that's how the book came about, essentially.
Okay. What's your advice to parents that may be concerned?
I think the best thing to do is, number one, talk to your doctor. If you don't feel like you can trust your pediatrician, you should probably find another pediatrician. But these are the people who have been trained to both answer questions about vaccines and also have 12 years of medical training in order to be a doctor. The other thing that parents can do is go to websites that are accurate and reliable, like ones run by the American Academy of Pediatrics, the Centers for Disease Control and Protection. There are a number of really good websites out there that address all of these concerns in very clear language. What I would definitely caution against is just going and typing in vaccines into Google and then start clicking on all of the links that come through, because there's no volume control on the internet. And so a website that someone happened to put up in their spare time could seem just as authoritative as something by the AAP, even though the reality is far different.
Just be aware of immunizations. Immunizations are very important. Vaccine preventable diseases are still out there, and it's something that parents need to be aware of. They need to be educated. They need to go to the correct websites, find valid information, and talk to their providers about what their children need.
If people have questions or would like more information, what should they do?
They can contact the Shots for Tots website. We have lots of information there. They can contact the immunization program in New Orleans, and they can also contact their local immunization consultant, which is on the DHH website.